Hi, welcome to another one of our Dr. Foot videos. In this video, I want to talk about a rather contentious subject. Well, I think it's a rather contentious subject, which is cosmetic or aesthetic podiatry. Now, when you mention cosmetic or aesthetic podiatry to some podiatrists, they start to turn green. They start to get really angry. As you can see, well, that's not really a podiatrist. If he was a podiatrist, he'd be an awesome podiatrist. But they start to get really angry, and it's because they really don't want podiatry to be associated with the word cosmetic or aesthetic. And I'll tell you a couple of reasons why that is, and I'll explain what I think cosmetic and aesthetic podiatry is. Now, in my earlier years of being a podiatrist, if a patient came to me and they were not in pain, but they didn't like the appearance of their nails or their feet, I was like, I can't help you. It's like I've been trained to take care of pain. So we're trained to say, how much pain are you in? We've got these VAS scales and these other scales that we use to see how much discomfort you are in with your everyday living and your activities, and how can we reduce that. But how do you characterize somebody who is so ashamed of their feet that they don't want to show them their feet in summer? And I have met so many patients over the years that are just hiding their feet all year round. They don't wear sandals. I know some patients who constantly wear socks. They don't even show their feet to their partners. They won't go on holidays to warm countries because they don't want to get their feet out. And in my younger years, I was like, I can't help you, but it feels a bit strange for me to say that because I'm such a cool, thoughtful podiatrist. But yeah, I was like that. I'm a lot more considerate now, and I'm thinking now, well, I'm of the opinion now rather, that we should take these patients' concerns really seriously. Really seriously. I would rather them come to a podiatrist than go to somebody who's had no training at all, and them to do a procedure on their feet which could cause more damage. So if it's affecting a patient's psyche, if it's affecting their self-confidence, then I think podiatrists and health professionals should take their concerns seriously. What cosmetic podiatry is, in my opinion, is procedures that podiatrists or podiatric surgeons can do to affect the appearance of a patient's feet. Now, let me give you a couple of examples. Ladies, if you have been wearing heels that look like this, then your feet are gonna eventually look like this. Or there's a higher chance of them looking like this. You can get bunions. You can get hammer toes, bunions. You can get other bony complaints to your feet from the result of wearing really tight shoes. Okay, so most podiatric surgeons, they will do bunion surgery on a patient even if the patient is not in pain, because they are usually of the opinion that this is going to get worse, it can progress, so let's try and solve this problem now. That's great. But what happens when you don't have bunions, but you've got discoloration on the top of your toes? And that can happen. I'm going to try and find a couple of pictures to actually show you. So sometimes just the skin will go slightly dark. What do you do then? Well, you can use dermal fillers to rehydrate the skin from inside. Now, this is not unheard of. It is done all around the world. It's not done much in the UK actually, but in America it's done a lot. And it's the same kind of dermal filler that women have in their faces. So when you have acne scars or discoloration, women have it in their faces, and it affects the appearance of scars and discoloration, hyperpigmentation rather. So you can have that done in the feet. And I don't think there should be such a stigma attached to it. If it affects a patient's psyche and if it makes them more confident, then why not? I don't see why you shouldn't. What happens if your nails are discolored or if you've got a fungal infection? Now, if you've got a fungal infection, you can treat it with lasers and oral medication, topical medications, and so on and so forth. But what happens if it's not a fungal infection, but something dropped on it or it's trauma and the nail's thickened? And I know ladies that will not show their feet because they have got thickened nails. Now, there is something you can do for it. There are quite a few podiatrists now in the UK that do nail reconstruction. You can do reconstruction for the nail, so you can build a new nail on. It looks and feels like a perfectly normal nail. It's not a permanent solution. It only lasts a couple of months, about 1 or 2 months, and then the patient comes back and has it done again. But during that time, if the patient's going on a holiday or they've got a wedding or they've got a party and they want to wear sandals, it's great. They can feel a bit more confident in doing it. Now, where cosmetic and aesthetic podiatry takes a bad rep is when patients want to make themselves taller. So there are some surgeons that will do surgery for that or make their feet slimmer. Now, I mean, I'm not a podiatric surgeon, so I can't really comment on this. I feel a bit uncomfortable with that. What I also feel uncomfortable with is podiatrists painting nails, like using nail varnish on nails. I think that's a job of a beautician. However, if a podiatrist is painting nails, then that's up to that podiatrist. Don't call it podiatry, however. It's more of a beauty treatment, and there's no way I'm gonna paint nails in a million years. So please, ladies, don't ever ask me. But yeah, it's just not gonna happen. However, I do think there is a role for cosmetic and aesthetics within podiatry. I firmly believe that. I believe if we can make a difference to a patient's life, if we can make them more confident, and if we can at the same time prevent any other pathologies happening in the future, then that's great. That's what we're here to do. Hope you found this video interesting and amusing, and I shall speak to you soon. Take care. Bye.